According to the World Health Organization, the Ebola outbreak that is ravaging parts of West Africa is the largest, most severe, and most complex in nearly 4 decades history of this disease. The virus disease has so far killed nearly 2,300 people and infected twice that number. Meanwhile, Cuba pledges the largest foreign medical team deployed so far in a West African health crisis. World News has the details.
At a press conference held in Geneva on Friday, WHO Director-General Margaret Chan warned in the 3 hardest-hit countries, Guinea, Liberia, and Sierra Leone, the number is growing faster than the capacity to manage them. She called for more actions and at least 2 to 4 times support in order to catch up with the outbreaks that were happening fast in these 3 countries.
We need more doctors, nurses, both coming from outside, we call it foreign medical teams. But to me, the most important piece is to make sure that we provide mechanisms to bring healthcare workers from the government to come back to work.
Cuba's health minister announced at the news conference that it would provide the largest offer of 165 health professionals to help fight Ebola.
We will cooperate with a brigade of 165 collaborators, consisting of 62 doctors and 103 nurses. All of them have more than 15 years of professional experience and have worked in other countries facing natural and epidemiological disasters, and also have worked in medical cooperation missions. 23% of them more than once.
Chan welcomed Cuban government decision. She also expressed gratitude towards the countries that had already provided support to WHO, other UN agencies, and most importantly, to the 3 countries. Meanwhile, in a statement issued by his spokesman, UN Secretary-General Ban Ki-moon warmly welcomes efforts by the international community. He also renewed his call for countries to refrain from closing their borders to people coming from Guinea, Liberia, and Sierra Leone. Ebola, transmitted through bodily fluids, leads to hemorrhagic fever and, in over half of cases, death. There is no specific treatment regime and no licensed vaccine.